Good. So, so my topic is nailing the residency exams. So what are exams anyway? I really think that exams, success, failures are all just feedback at the end of the day. They're not a life sentence. So, but as a resident in post-graduation, exams acquire new meaning. It's no longer just for passing. It's no longer about marks. It's not about, just reading the previous day and trying to kind of just get through. It's about your life, your craft. It's about how good you are at your job and how good you're going to be. And there is always that internal examination that is always going on, the 360-degree global assessment by your teachers, by your staff. So that's about your sincerity, your punctuality, your seriousness, your patient approach, how courteous you are, how polite you are. So I really think that residency exams are all about daily effort. It's about reading something every day. It's about that interesting case you saw, for example, a pigment dispersion syndrome. You look at all the signs, your senior points them out to you, and then you go home and read about PDS and you're never going to forget about it. Daily effort also means resisting the temptations. You can do without going for that dinner, or you can do without going for those movies every 2 days. I think you should just do something that rejuvenates you in a very short time and you get back to reading your study material. So I often used to hear this as a resident. My seniors used to tell me, वो क्यों पढ़ रही है, वो रायन है, वो तुम्हारे लिए नहीं है, तुम folder पढ़ो, तुम DOS article पढ़ो. I really think that, believe it or not, you are allowed to do wide reading. You are allowed to read Jacobi and Ryan and Krashmer. And I really think that these big books are actually having the most beautiful sentences that make you grasp about the material, about what you want to know. And I really think you should read what you grasp from. So I found that the AO series, the Basic Sciences and Clinical Sciences series, is something I grasped from. So I made it my base. And you read from everywhere. You decide what you like best, but don't forget to make it revisable. This is my Kansky book. I used to read from a lot of places and have these pages stapled onto my base book. And then there are these beauties called review articles. You get a lot of information from review articles about one particular subject, starting from very historical perspective to the latest of what's going on. So classes are a part of your curriculum. So how do you prepare for a class in residency? Coming blank to a class is a crime. You know the teaching schedule in advance, you know the topic a week in advance, you read from a standard textbook and make your own notes. 3 to 4 days before the class, you ask the guy who is presenting, your colleague, about what he read from, and then you read that, and you add notes from that to your existing notes. And then during the class, you add some more, and then you ask questions. That is the most comprehensive way to attend a class. And that topic is going to get cemented in your brain forever. And of course, teach your juniors. My seniors used to launch into impromptu lectures about, I don't know, nanophthalmos and pseudo-exfoliation. And I carried on that tradition, and you present cases to your SRs. This is crucial according to me. I think you should call each other by name, even your senior residents. You can be polite without saying sir or ma'am. Why I say this is because juniors also teach. This honorification, sir, ma'am, it removes scope for argument, it removes scope for critical thinking. And stop it, guys. Everybody, we are all children in residency, and I think we should just be friends. So there are round days in at least my residency program. There were days specifically for rounds. So in rounds, you be tuned in, and correct or not, you talk. You take flights of ideas. It is good practice to talk in exams. Many people are tongue-tied during vivas. Rounds can get you, over those issues. If you're wrong in rounds, you read and come back, and your teachers will love that. And they will go out of their way to teach, and you need to discuss diagnostics and interesting cases. Dr. Vijay already told us about how many procedures we need to do. We have to really be good at it. I think an entire examination should take only about 10-12 minutes, and it should be a global examination from anterior segment to posterior segment. You make note of interesting cases. These are those just extra points, extra miles you go, help your professor draft papers and do your thesis well. Meetings and conferences are very important. It adds that extra knowledge to you. I still remember I owe 2 of my answers in my residency exams about radiation retinopathy and spasmus nutans to those small Delhi Ophthalmic Society meetings that I attended where these cases were discussed. And it was all about audio-visual impression that lasts forever. Very important, volunteer for your senior batches examinations. It's an amazing first-hand experience for knowing how your exams are going to be. And of course, there are these PG teaching programs that you can attend, which gives a very good comprehensive overview of many topics that are usually asked in the exams. Towards the exams, 3 months before, you start stratifying. You know what you know, what needs revision, and what is unknown. So everybody else is poring over their books. You don't have to. You've studied for 3 years. Just relax. So day before the exam, don't study after 9 and eat a balanced meal. Sleep for 7-8 hours. And this is a beautiful answer written in one of the mock tests in our institute by my resident. She's done a great job. You will see that there's crisp, short sentences, minimum cancelling out, and these flow charts and little drawings that she's made that catches the examiner's interest. So this is a very important slide. It's a do's and don'ts before practicals. Again, you have to look presentable, prefer pastels over red and black clothes, reach an hour before, know your exam well, how many long cases, how many short cases, how many table vivas. There are people who kind of miss one table and it's like the loss of 10 marks. And revise case protocols well. Do not take anti-anxiety, do not take sleep medication. They muddle your brain. I have known my seniors who've taken these and it's not gone well. Don't do anything out of routine. My friend went out at 3 a.m. in the morning to cool off and he was stabbed by thieves on the day of his examination. So that is something you don't want. Don't do anything out of routine on the day of your exam. Don't look shabby and don't try to find out what cases are there in the exam. So if you do say something wrong in the exam, in the practicals, there's no need to panic. My exam, one particular slide, I didn't know what it was, and I was honest about it. He just moved on to other things, and I was able to make up for the wrong answer. So don't kind of, be shattered that you uttered something wrong, and don't be upset. Just relax. And when the exams are over, you celebrate, regardless of how your exam went. You were focused, well prepared, you did your best. And exams are just a blip in the larger scheme of life. And there are loads of opportunities to prove ourselves in fellowship and in practice. And the best preparation for tomorrow is doing your best today. And like I said, I would like to reiterate that residency exams are about daily effort, and it's not just about last-minute effort. Thank you.